All right, a warm welcome from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation, and I'm with Charlotte Mbou from the Geneva Learning Foundation in Ebolova, Cameroon. And a warm welcome to everyone. We're here because we are now 7 days away from Teach to Reach. Let me get myself out of the way, and we're going to start the reveal of the final schedule for Teach to Reach 9 in 40 seconds. So if you've been wondering exactly what we'll be discussing, who will be there, my first answer is to say you're the one who's going to be there, and you're going to be learning from other practitioners just like yourself. We'll tell you more about that. If that initially doesn't make any sense, let's come back to that in 20 seconds. You can count down with me. A warm welcome to you. I'm Reda Sadki from the Geneva Learning Foundation, but we're here for Teach to Reach Connect. We are 7 days away until this massive event. We don't know the exact number, but we already have, I believe it's nearly 18,000 health professionals in particular, but not only immunization professionals ready to go 1 week from today. You may be wondering, what is this Teach to Reach? Well, we asked Kate O'Brien who leads vaccination at WHO, and Ephraim Lumengo from UNICEF, who leads vaccination there. And here's what they said. Teach to Reach is proof that immunization professionals are hungry to learn and hungry to share. If you're wondering what difference participation in Teach to Reach makes, well, here's a simple one sentence from Nabwagamo Habiba, who's a community health worker in Mukono district in Nama sub-county, Uganda. And here's what she said. Teach to Reach has helped me learn to monitor and advocate for timely delivery of vaccines for children in my community. And that is that is one example amongst many. We're going to turn to those we call guests of honor, Teach to Reach contributors who've taken the time and care to answer a number of, in some cases, complex questions across a variety of topics such as HPV vaccination, measles, but also topics outside of immunization such as female genital schistosomiasis or climate change and its impact on health. So I'm going to start with Mercy Tengen. And Mercy, yes, I see that you are ready. Two questions. You're actually seeing the second question first. But first, do introduce yourself. Tell us how many sessions of Teach to Reach you have joined. This is Teach to Reach 9 coming up. What do you expect from Teach to Reach? But first, introduce yourself.
I'm Mercy Atigni Tengan from Ghana. This is my first session I'm planning to join. And what I expect from Teach to Reach is to learn from experts and other colleagues in other countries as to how they manage immunization reactions, and acceptance rate of new vaccines.
All right, wonderful. And I just have a quick question for you. Are you in a place where you are vaccinating babies, or is that your child that we're hearing?
Okay, that's my child you are hearing anyway.
All right, wonderful. All right, I hope he or she's okay. All right, yes. And then second question, Mercy, is what challenge do you need help with that you're in your immunization work that you're doing currently? And how do you think Teach to Reach can help you with this challenge or problem that you're facing?
Okay, I'm not directly involved in immunization, but I work in a health center. And in that facility, we have the public health where they do the immunizations. But one of the challenges I see they face is the number of vaccines in a vial. For example, having 20 doses in one vial, meaning that when you get clients and you don't have up to the 20 and you open the vaccine, the rest of the vaccine becomes a waste. Meanwhile, there is always shortage in the vaccine. So I don't know how best we can solve this challenge to help the children get the vaccines when they need it and to reduce the wastage.
Thank you, Mercy. That's a very clear and specific question. Thank you for introducing yourself. And so you'll be there in 7 days with that question in mind when you meet, network, and learn with fellow Teach to Reach participants. Just want to take, before we go to Tusime Ramadan from Uganda, just want to take a few minutes to greet just a few of the people who are connecting via social media. So Husseini Magaji, who says, good evening. Hello, nice to meet you all from Nasarawa State in Nigeria. Tell us, Husseini, what you do. And you can answer these questions on YouTube and we'll be able to show your answers. What do you expect from Teach to Reach? And what challenge do you need help with? And then Margaret Odera, who says hello, thanks, hello back, Margaret, and who says nice to be here. Margaret, tell us what has brought you back, I believe, to Teach to Reach for the 9th edition. Tell us what you're expecting and tell us what challenges you actually need help with. So now let's go to Sime. Let's see. I hope, yeah. And we're always, all right, Dr. Tusime Ramadan from Uganda on the border with the Democratic Republic of Congo, Fort Portal, I believe. Dear Dr. Tusime, tell us, what do you expect from Teach to Reach 9 and what challenge do you need help with? How do you think Teach to Reach can help you with those challenges? But please do introduce yourself first.
I'm Dr. Tusime Ramadan from Uganda, a retired medical doctor, working with Humanitarian Volunteers International, a community-based organization on a volunteer basis. What I'm expecting is that high hopes in Reach Teach 9, because we shall hear from other people from other countries, and we shall share and we shall discuss. The challenge maybe I need is I'll be getting some answers, because the biggest challenge here is that people have misbelief in immunization, thinking that they have other motives underground to control population in Africa. So I have high expectations to hear from other people from other countries, and we discuss and we learn more from each. Reach to Teach, we get more experience of playing.
Thank you very much, Dr. Tusime Ramadan. Now, this is another quote from Dr. Kate O'Brien, who's a director of immunization at WHO headquarters, and Ephraim Lumengo, who's a chief of immunization at UNICEF. Learning happens best when people seek answers to their specific daily challenge. And furthermore, they say we need to do more to empower immunization professionals to identify and solve their own problems. Think about that and think about what's brought you to Teach to Reach and how you think it will be useful to you. We're now going to go to Anifat Gujombi, who is ready to go, I believe. Anifat, a warm welcome to you. Do introduce yourself and then tell us what are you expecting and what's the challenge or problem that you face in your work that you'd like Teach to Reach participants to help you with.
Okay, Dr. Eda, I'm enlightened I'm so amazed to share my challenges on the immunization to you. First and foremost, though I'm not directed with the immunization palaver, because I'm a medical laboratory scientist and not nurses or the vaccine, the chew. But in our center, I think when the Nigeria is being advocate for the HPV, but people are not ready to be immunized for the HPV. Instead, they are thinking that maybe they want to use that one to reduce the population in our country. That's what they used to say. But I try to correct them that it's not like that. HPV, I tell them about the HPV, that is human papillomavirus, that is almost affect female most, though it can also affect male. But instead, though I'm trying to convince them, maybe during the meeting, I will suggest that the announcements should be more, that people should be aware of this particular virus. Likewise, the doses of in the vial of the vaccine. Maybe we can the WHO in general can reduce the doses so that it will not allow any wastage again.
Right.
Those are the challenges that I can focus that is affecting the immunization and vaccine for the children, given for the children.
Thank you very much indeed, Anifat Egunjobi from Nigeria. We have Margaret Odera, I believe from Kenya, who says her biggest challenge in Nairobi is vaccine hesitancy due to religious beliefs. So this theme of disinformation, misinformation, demand for vaccination, and the things driving that in the following the first 3 years of the COVID-19 pandemic is a complex topic indeed. There have been many discussions, many sessions around this, and I encourage you. There's a whole your database of knowledge, of learning, of shared experiences. If you look at the YouTube channel of the Geneva Learning Foundation, let me show you that. If you haven't been there yet, you can find a gold mine of resources specifically on these topics, especially vaccine hesitancy. So you can see under the videos, you have to dig a little, but you will find hopefully useful stuff. Now, today we are here because we are about to do the reveal of the final schedule for Teach to Reach 9, and I'm going to give you a quick peek here. We're not going to go into it right away. You can see the event is starting in 6 days and 15 hours, and here if you go to the schedule, you will see now. Here's a tip for Anglophones. If you scroll down, you're going to see content in French. All right, do not panic. Teach to Reach is a bilingual event. If you don't speak a word of French, when you get to the schedule, there's a very simple solution. You go to the little funnel here, and then you will go select English, and that is how you see only the English language sessions. Of course, if you're bilingual, then you do want to keep both. And so you can see here, you can discover the full program, but we have one more person at least to hear from. Okay, great. Here is Dr. Farid Ahmed, who says, I would like to know how we can vaccinate in mountain areas where there's no electricity and no road communication. And this is, he's coming in from Bangladesh. So that's a challenge. It'd be really interesting if you're on social media following this, if you have experience in reaching remote, difficult to access areas, and you'd like let Dr. Farid Ahmed know that you will actually be at Teach to Reach. The same if any of our guests of honor are in the room. I also take note of the comments in the chat. Let me see if I can get that. Yeah, in our Zoom studio. Okechi Nzedibe, who says Teach to Reach is an incredible platform to build from the experiences of others in the field. Now, here is the time to actually share with you what Teach to Reach will be about this time. So, you will find at Teach to Reach plenary sessions. We're proud to announce that once again, and I believe this is since Teach to Reach 6, so for the 4th time, UNICEF will be our flagship partner for Teach to Reach, and there'll be a major plenary session. I'll tell you a bit more about that. And that is on identifying and reaching zero-dose children with vaccines in urban and peri-urban areas. We have some great guides on the side. We'll explain what that is in a minute. And also very pleased to announce that the Gavi Zero-Dose Learning Hub, our global partner, the JSI, John Snow Incorporated, that is leading the Zero-Dose Learning Hub Consortium, will be presenting and discussing with you what is this Zero-Dose Learning Hub, what it's all about. The opening ceremony will be once again opened by the women who deliver vaccines. This is a self-organized collective of women who work in vaccination at all levels of the health system. They'll be leading the session on to try to find, search for, explore answers to this question: how have you made HPV vaccination work for girls and women? And just to make the point, let me see where it went. Yes, so we had at the last Teach to Reach 8 session in June 2023 a number of quite a tremendous amount of feedback. Like this one. So this is Maneya Mwansakilwa, who's a midwife for the government in Kanyama, Zambia. And Charlotte, could you read us what Maneya told us about what she learned at Teach to Reach 8? Charlotte may be having connectivity issues. Charlotte, are you able to speak to us? Yes.
Yes, I had issues of connectivity, so I lost you there for a moment. So
it happens
can you
to
come
everyone.
back?
Yes. So yes, could you? This is what was shared. We know that there'll be a big HPV vaccination session at Teach to Reach, led by the Women Who Deliver Vaccines Collective. Can you tell us what Maneya Mwansakilwa, who's a midwife from Kanyama, Zambia, said that she learned from the Teach to Reach 8 session on this topic?
Yeah, with much pleasure. I learned that HPV vaccination cannot be achieved if healthcare workers work in isolation without involving other stakeholders.
Thank you. All right. So we have you will find these postcards across our social media. For those of you who are in our Zoom studio, I'm going to share the links if you'd like to follow and see more great quotes and early learning from both Teach to Reach 8 and Teach to Reach 9. That's an amazing opportunity to do so. Just to emphasize, at this Teach to Reach, alongside the immunization topic around HPV vaccination, it will be the topic of neglected needs of women's health, with a specific focus on female genital schistosomiasis. So, Charlotte, could you tell us a little bit about FGS in 2 or 3 sentences maximum? I know this is a topic that matters to you.
Yeah, female genital schistosomiasis is one of the most neglected tropical disease that affects close to 56 million women and girls in sub-Saharan Africa. And so with our partners, Bridges to Development and the End Fund, we had a workshop last May on female genital schistosomiasis, and those who think that this matters to them will be at Teach to Reach to share what they are doing to lead the fight against FGS. Thank you, Rena.
Thank you, Charlotte. All right. And then one more topic beyond the bounds of immunization, but closely, more related to immunization than one might think. And this is on the 28th of July, we held the first special event. The topic was From Community to Planet, Health Professionals on the Front Lines of Climate Change. And this special event was attended with 4,700 health professionals who registered for the event. And what you told us, we asked you to share your observations of what's changing in the climate where you work, especially if you've been working there for a long time, and what changes are you seeing on health? And then asking the question, do you think there is a relationship? And this is one of the things you told us. 1,234 respondents said that most of you think that climate change is indeed a threat to the health of the community that you serve. So we'll be discussing that at Teach to Reach. And then the running theme since we launched the Movement for Immunization Agenda 2030 on the 7th of March 2022 has been to a call to join the movement. And at Teach to Reach 9 next Friday, you'll be hearing remarkable stories, fresh stories from the field of the impact that IA 2030 leaders are achieving by implementing where they are connected with everyone else, with thousands of like-minded health professionals working towards the same goals adopted by every country in the world at the World Health Assembly in 2020. So that is what will be happening at Teach to Reach. Some of the selected themes, last but not least, I haven't mentioned the open source manifesto, but you can see the themes here: Movement for Immunization Agenda, Reaching Zero-Dose Children, Climate Change and Health, Neglected Needs of Women's Health, and HPV vaccination and cervical cancer. So now we're going to go back, now that you've had the reveal of this session. We're going to ask you which session is of greatest interest to you, and why. All right. So here, back to you, Charlotte, to choose who we'll be hearing from in response to this question. Which of these sessions at Teach to Reach? We've just revealed the final full schedule and program, and we'd love to hear from participants. If you want to answer, raise your hand. Otherwise, we may volunteer you. Aminu Yunusa is unmuted. Aminu Yunusa, we'd love to hear from you. Do introduce yourself. Tell us how many sessions of Teach to Reach you have joined, and then tell us of what's on the schedule for next Friday. Which session, which is of greatest interest to you, and why?
Hello, sir. My name is Aminu Yunusa. I'm from Kano, Nigeria. This is my first time to attend a Twitch to meet, so I'm really glad on this program. So I'm happy. I'm happy, a lot of happy being here. So I'm excited to learn a lot of things related to immunization, because I'm a RI service provider here in Nigeria, especially in Kano State, mostly immunization service provider. And it has a lot of challenges, related to immunization, especially in our community. So, of course, one of the challenges that we face is that is stock out of the vaccine during immunization activities. Maybe like when we have a target or maximum stock that we need during our immunization activities. So we are not to get that maximum stock. We stock out in some months.
I understand. Yes,
so that is,
Aminu. Yes.
no, okay, so do you have? Hello.
Yes, I believe your connectivity is breaking up, unfortunately. I suggest you type in the chat, and we're, for those of you who are our guests of honor in the Zoom studio, we can see and we can share what you're typing. So if you have connectivity issues, that's probably the best way to do it. Want to recognize contributions from Davies Harfor Larbi, Anifat Egunjobi, who has a comment about achieving HPV vaccination, Rebecca Bello, Boma Otobo, as well as all of those who are commenting across social media. Charlotte, who's next? We have just a few minutes left, and I suggest we finish with really the reading to conclude, but also to say see you next Friday is to conclude with reading the first part of the first two parts of the manifesto. But first, let's hear from at least one, hopefully two other people.
Hello?
So, Brother Melese Teferi has his mic unmuted. His hand has been raised for quite a while. So, Melese, over to you, and do start by introducing yourself, please.
Thank you, Charlotte. Thank you, Rada. How are you doing? Hello, scholars. I'm Melese from Ethiopia, Addis Ababa. I'm working in a research institute, Almahansa Research Institute, which is under the Ministry of Health, Ethiopia. And I'm one of the young researchers working in different subject areas, mainly focused on vaccine and immunization-related activities. I'm passionate and working previously in immunization programs. I was also conducted different surveys in vaccine preventable diseases. So I was actually a long member of this movement from the starting to until now. I try to just contribute my part as a public health professional. I just expecting from this next history that we all professionals share our experience to develop a strategy that can address the current immunization-related problems, especially these high zero-dose children and under immunized communities. From the next session, actually need to be focused on zero-dose children, even though other two sessions are very important, but I need to be focused in addressing zero-dose children, because it's the main challenge that even I develop my action plan. So this is my focus that I will be more engaged in the District 9.
Great, thank you. And indeed, we do have two great sessions, full plenary with UNICEF and a presentation from the Gavi Zero Dose Learning Hub next Friday at Teach to Reach 9 on the 13th of October, 2023. I think what we've been missing is hearing about actually the heart and soul of Teach to Reach Connect. We call it that because at the heart of the event is the opportunity to have networking sessions. So you go into the platform and you click click on a button and you'll be connected with another health professional, and you can have a discussion around the issues and challenges and solutions that matter to you. You can already discuss what you heard in plenary of what you've learned elsewhere, and also ask for help or offer to advice to those of you who want it. Now, the one component of Teach to Reach that I have not mentioned is what we're calling the Manifesto for Global Health, that has different names. We haven't finalized the names. We probably need to have a consultation to finalize that. But we're now at version 2.0. So we presented the original version 1.0 at Teach to Reach 8 on the 16th of June 2023. And for this one, we've had, since that presentation, we've taken the inputs from over 1,300 contributors who shared their experience and incorporated that, weave that into this Manifesto for Global Health, so that it is now more than ever, now more than version 1, your manifesto reflecting your experiences and what you have been saying and sharing with each other about global health. And to finish this session and say, see you next Friday at Teach to Reach 9. This is only to reveal the full schedule and the final schedule for Teach to Reach 9. I'm going to turn it over to Charlotte, who's going to read the sections of the manifesto that are, not the full thing. You'll have to wait until next Friday. But here is the first part of it. Over to you, Charlotte.
Thank you, Reda. So I'm going to start with who are we and where do we work? While many of us have trained as health workers, we also come from other professional backgrounds. Teachers, social workers, scientists, academics, and technicians. Some of us are volunteers. We receive little or no payment for carrying out health work in our communities. We come from all levels of health systems and are aware of the strengths and limitations of these large and complex organizations and the critical role of political direction and leadership in making these systems work. Some of us lead big teams at national and regional level. Others are responsible for specific areas of work within a local facility or across facilities. Many of us work with poor communities. For some of the people we work with, healthcare is not a priority above economic activity to survive. The community may be geographically hard to reach, suspicious of government or by extension us, or hold religious or cultural beliefs that do not easily adopt the science we base our work on. Some of us highlight how decisions about housing, sanitation, and education affect the health of the communities we serve. Decisions on these things are made without reference to population's health needs. COVID-19 has, for many of us, highlighted the fragility of the systems we work in and our relationships with communities. For some of us, it has meant more investment and renewed political focus on healthcare. For others, it has meant cuts in key budgets and the rise of new threats to our work, such as rumors spread by social media. Many of us remember the fear of the early days of the pandemic and losing colleagues and friends, and often carried out our work without adequate protective equipment. For some of us, this period confirmed why we signed up to work in health. For others, this period was a source of mental stress and anxiety. Each of us working in a unique context. The nuance of community structures, culture, and religion interact with the structures, image, and resourcing of our health systems. To be successful, we must make this interface work. Those of us who work in humanitarian contexts report further dimensions of complexity in our work. Our security is often not guaranteed. The facilities and equipment that we rely on may be targeted and destroyed, and our target populations may be inaccessible or displaced. What motivates us to work in global health? Many of us describe growing up in communities with limited access to health workers and experiencing the avoidable deaths of family members and friends at young ages as a factor that motivated us to become health workers. The sense of serving our communities is strong, and is the sense of the importance of our roles and the respect that they can engender among community members. For some of us, health work is seen as a stable career that allows us to support families, and a few of us are being recruited to fill gaps in European health systems. Yet for others, pay is irregular and promises of payment are broken. Fortunately, money is not our only motivation. We speak of the feeling of success when a child is reached and cured or immunized against a life-threatening disease. We describe being motivated through involvement in decisions that affect us, through the recognition of our leaders as well as community members, and through the ongoing support of partners who want to support our communities to be healthy. Thank you very much.
This is the first part of the manifesto. Over 1,300 health professionals, health workers, health volunteers from all over the world have contributed to it. This is, we hope, your manifesto, and we want to thank you and honor this at Teach to Reach 9 on the 13th of October, where we will be presenting the full version, and it'll be read by some of the authors, co-authors, contributors, and guests of honor of Teach to Reach 9 and of this manifesto for global health. Thank you. We hope, let us know if this speaks to you, what else, and we'll be also inviting all Teach to Reach participants. This is important to actually continue to contribute to strengthening this manifesto so that it is the individual and collective expression of your many voices, not just for immunization, but across anyone working for the health of their communities. Once again, thank you. One last thing to ask, if you have not done this yet, please share with your colleagues, continue to share with your colleagues. This is the best way we have. You'll see this if you're in our Zoom studio, you'll see a magic WhatsApp link. If you click on that, you can share with your colleagues. And we hope really that you will have the time, you won't be taken up by work duties, you won't be in the field, and you will have the connectivity you need in order to join us next Friday. This is an event you do not want to miss. Thank you very much indeed. Take care.
Next Friday.
Only 7 days left, and for those of you who don't know how to get there, a very quick tutorial. Search for Teach to Reach. You can use Google, you can use anything. Teach to Reach 9. Once you find it, you request your invitation. Here, you put your name, not mine, obviously. You put your email, and then you click on request your invitation. It'll take you a few seconds, and then you'll start receiving a chain of emails because we ask you questions. That is really why we send you all these emails, to make sure also that this is in your calendar and that you don't miss this incredible opportunity. Nearly, I believe we're close to the 18,000 participant mark. That is absolutely amazing, and we hope that you'll be there. You do not want to miss this. Once again, thank you, and goodbye. If you're in the Zoom studio, this is the time to send your messages. The same if you're on YouTube, Facebook, LinkedIn. Let us know what you're expecting from Teach to Reach. Let us know what challenges you face, and let us know why you're coming. We thank you. Ukamaka Okafor says, thank you, I'm excited. Ibrahim Abdullahi Maikano, thank you. Salam Dakam, it was great. And this is just a warm-up. This is just the reveal of the full schedule, which is now available on the Hopin platform we're using for Teach to Reach. Once again, thank you. Last chance to get a message in if you want to hear your name. Anifat Egunjobi, thank you. We heard from you today. Olaide Oyelaja, especially if this is your first time to come to Teach to Reach, we warmly welcome you. and look forward to your contribution and shared learning together. Thank you and goodbye. Or I should say see you Friday.